Actually, wait. As far as her thyroid, oh, she had stopped it. Actually,
okay, this is Ask Dr. Vaughn with the back of Dr. Gawayne's face, or the back of his head, which he's very popular among our Periscope followers, so that's why we include him in it. Hey, Matt, Addie, thanks for joining us. Grant and Eric, thanks for being here. Go ahead and turn it around. We may be able to get something out of him if we're really nice to him today. Oh, thank you for the hearts, by the way. I'm sure that they're all for Dr. Gawayne and not for... And the back of your head, as he's working feverishly to get out and see his family. Mr. Hijinks, thanks for joining us. We are glad to have you here. And yes, Mr. Hijinks. And we are acknowledging that there are lots of hearts when we show Dr. Gawayne Vaughn. So I'm just, he's shaking his head. I know you guys like him. I know you like Dr. Bradley, is that what it was? No. Brady. Tom Brady?
Apparently. The one who cheats
at
football.
He doesn't appreciate being called the...
How I'm being compared to a cheater.
Okay, so we actually can answer questions, and in fact, if we get on an interesting topic, he might chime in, and we'll... Only if it's interesting. And we... Single or double Windsor? I'm a double Windsor. How about you, Dr. Gawayne? Let me show you. There.
No Windsor.
I am a double. I like the younger men with a relaxed... He likes to rub in the age issue. Oh, Sherry. California Sherry says, hi, doctors. She's from... Let's see. She's from the Bay Area, right? I'm trying to remember. And Hazanaya, I see your emoticon. And we're glad to have you here also. I feel like the double Windsor is more straight and even, and I don't know. You can tell he's the more relaxed guy. I'm the more buttoned-up guy. Polly, wouldn't you say so?
We need both.
What do we need?
He's the more relaxed guy. I'm the more buttoned-up guy.
I mean,
uptight. They're asking me if I wear a double Windsor, and I was explaining yes. I like the.
Showing my no Windsor.
And
It beats a bow.
okay, and I'm not showing Polly because she doesn't want to be on camera.
I'm not into periscopes.
She's not into periscopes. Kaylin, thank you for joining us. We're glad to have you here also. So we had a great discussion yesterday evening about bugs and ears. That was fun.
I'll send that to you. And the other stuff we'll discuss at her appointment.
Oh, California Sherry's talking about tendonitis in a child. And when I need to make a bowel movement and can't right away, I get horrible pain, almost making me, wait for it,
pass out.
Drop.
Yeah, called it.
Oh, I'm sorry, it's not a child, she's 20. I guess I thought California Sherry was 20, and so the child would be younger. Drop to the floor. Drop to the flow, but it wasn't flow, it was actually floor.
Well, if you're in LA, it's flow.
If you're in LA, it's flow.
Drop to the flow.
Oh, okay. What's that got to do with LA? Drop to the flow.
More gangsters there? I don't know.
How does weight affect kidney problems? Do you have prostatitis, sir? Do I look uncomfortable? Oh, he's talking about the guy who drops to the flow. Dr. Matt here. Dr. Matt, thank you for joining us. Please save us from this madness. LOL, I was 20, 30 years ago. I'm 20. That would be Grant, who's 20. So I don't think so. Oh. He doesn't think he has prostatitis because he's only 20. It's 20-year-olds who get the prostatitis we treat with the other antibiotic.
Is he a biker?
He might be a biker. And somebody's asking about IBS. And I'm 29, and I had it. Matt Addy had it, and he's only 29. There you go. In your face. Of course, if he was only 29, that would mean we treat him with the other... am I embarrassing you, Polly?
No, not embarrassing me, possibly.
The other antibiotic. Who knows why we treat prostatitis in men under the age of... What's the age, Gawayne?
What?
Is it 30? Prostatitis, where we change what antibiotic we treat them with.
Yeah, I think 30. I was thinking 25 for some reason.
20, you thinking 25? I'd have to look it up. But 25 or 30. Can anybody tell me in Periscope land why we change the antibiotic we use in men with prostatitis? Grant says, so there's an over-the-counter I can take to help with it. I forgot what it was. Was that dropping to the floor when you have a bowel movement, or was that prostatitis? The 25 to 35 age group gets big boy antibiotics. No, other way around. Other way around. If you're older than 30, 25 to 30, somewhere there. If you're older than that age, you get big boy antibiotics. If you're younger than that, you get a different antibiotic. Why? Who knows? It can affect risk of cancers. Wrong. No. Drug resistance. No. Harder on you. No. Yeah, the pain with it's like a pulsing pain. Okay, I love the hearts, by the way. No, none of these are reasons that we use a different antibiotic in younger men. Angela Hackett joined us. That's my sister-in-law, by the way.
Oh, yeah.
There, Dr. Gawayne.
I'm sure she's going to love this conversation.
Okay, Angela, let me tell you what we're talking about. We are talking about something called prostatitis, inflammation of the prostate gland. It occurs in men. Now, it can occur in men younger than 30. It can occur in men older than 30. And right now I'm asking why we use an antibiotic that's different depending on which age the patient is. Anal spasm could be the throbbing effect. I guess that would feel like a throbbing. And you can actually have that with that disorder, kind of a throbbing. Actually, usually it's more of a dull ache, I think. I don't know. Never had it, so I can't say from experience. How about you, Dr. Gawayne?
I've never had it.
He's never had it either. But our understanding is it's a dull ache felt in the perineum, that area between the genital organs and the rectum. Kind of a fullness is usually what it's described as. So, still we don't have the right answer as to why we use a different antibiotic under age 30 compared to over age 30. But you guys did have some good guesses, I'll say that. Okay, I'll go ahead and tell you. The reason, oh, one more guess. So it doesn't affect sperm production. Nope, that's not it. Sort of along the right track. Of course, it is the genital tract, so anything along those lines would be along the right track. Hemorrhoid. Hemorrhoid? Hemorrhoofs? I guess that's when you sit on the roof too long, you get hemorrhoofs.
Yeah. Or a hemorrhoofy.
Or a hemorrhoofy. No, roofy's something else. But which may be related to why people get a different antibiotic if they're under 30. Does anybody know yet why we use a different antibiotic? So your weenie doesn't fall off. LOL. No. It will fall off just as many times with one antibiotic as the other. No, it doesn't get affected. Give the young men roofies. That's very disturbing, but it could be why we use a different one. The body is resistant. You guys are you're providing lots of possible reasons why, but not the answer. Should I just tell them?
Yeah.
Okay. It's because the age difference there, studies have shown that different bugs or bacteria tend to be causing the infection. In men younger than age, and I'm sorry, I don't remember if it's 25 or 30, but it's, I want to say 30 myself. In men younger than age 30, they tend to be infected more with sexually transmitted diseases like gonorrhea and chlamydia. Men older than 30, it tends to be E. coli or coliforms, the type of bacteria that are found in the gut, the colon, the intestinal tract. So because of that, we use the age difference to determine which antibiotic we go with. And somebody's going to say they're drug addicts. Nope, something else. Empire City Ray, thank you for joining us. Please save us from this discussion, please. Okay, Grant says, well, I had ulcers, and they had to do the whole finger in the butt. Wouldn't they have noticed something then? Not necessarily, but you may have. You may have noticed a whole lot of tenderness when they're pushing on the prostate gland. Also, sometimes if it's really bad, the prostate, instead of feeling like, I don't know, moderately firm organ in the body, can feel boggy. That would be bad if it was so infected it felt boggy. Not if they had short fingers. Then you just have to push more. You got to feel the gland. Yep, that's right. Some people, reminds me of the story I've told you before. Oh, hemorrhoid talk? LOL. No. We were talking about prostatitis, inflammation of the prostate, or actual bacterial infection of the prostate. And by the way, I am finding, I don't remember learning this in medical school, maybe you didn't either, Gawayne, or residency, that prostatitis can be very hard to get rid of sometimes and keep coming recurrently over and over. You did learn that in your training?
Yep.
Oh, okay. He had better training than I did in prostatitis, which makes sense because family medicine would be treating people with recurrent prostatitis more than somebody in the emergency department would be even treating prostatitis. You wouldn't even go to the emergency department for that. Angela, I am so sorry for the timing here. This is not quite the exact topic I was anticipating discussing when you joined us, but hold on. There are other topics we do talk about, like bugs in ears. That was a good one. I think you saw that one or heard that one or saw it. Yeah, it's a visual thing. Empire City Ray. Yes, we were talking about the prostatitis issue. If you're getting pain where you fall to the floor, if you don't want to go to the bathroom, get checked. I gained weight on antidepressants. If I raise the antidepressant dose, I will gain more weight. Actually, yes, you do gain more weight as you go up. But, Angela says, no problem. Thank you, Angela. You're so understanding. Empire City Ray. Yeah, the ears was great. Okay, the question about antidepressants. Antidepressants often are associated with weight gain. Up to even half of patients who go on medicines like Prozac will gain weight. You're welcome, Grant. And here's what's going on. They are not getting the normal message from the stomach to the brain that they're full, the satiation, and so they just keep eating. If they're eating until they feel like they've finished eating, they'll keep eating. If they normally have a disciplined diet of a standard amount of food, like a plate size or some kind of prescribed diet from their prison warden or their hospital nutrition department, then they won't gain weight because they just keep eating the same amount. And if you go up on the dose, they can be worse. Doc, trace amount of blood in urine are indicative of what? Possibly of just simply having a trace amount of blood in the urine, which happens in some people. But you get worried about all sorts of things. And so the way to track it down, if it is there consistently, is to do a scope, a uroscopy, where they stick a long tube with a camera on it through the urethra into the bladder, check that out. And if that's all okay, they'll even check the kidneys and ureters. Although they don't do that with the same uroscope, do they?
What?
How do they check the upper urinary tract for trace hematuria? Hematuria, there's a word for you. Blood, urine, hematuria.
Yeah, that's
hematuria.
That's operative.
Do they just do it with?
But you can do a CT urogram, and that's probably the first step.
CT urogram, CAT scan specifically of the urinary tract.
Yeah. Beyond that, that's.
But they don't really. You can't get
my expertise ends.
They don't get a scope that can actually. We've both seen uroscopy where the scope goes into the bladder. We've seen that. We have not seen actual direct visualization. That's not direct, is it? Of the ureters. This only happens to males, bladder infections. No, females also can get uroscopy and have blood in the urine. And the uroscopy is the same, it's just the scope's a little bit shorter. Kidney stones. Yeah, kidney stones can cause blood in the urine, can cause so much that you can actually see it. Infections can cause blood in the urine. And these are things that will pass. That actually has two meanings. Would that be a double entendre? Does that entendre? Does that mean you have to go look it up?
Entender.
No more innuendos.
Innuendo.
I'm going to go look that up.
Go look that up.
If you know what I mean. Just Andrew Tom, thank you for joining us. We're glad to have you here too. And we had a good discussion of prostatitis and microscopic hematuria. Microscopic hematuria being you can't see it. Gross hematuria being you can see a change in color in the urine. That's something. Yes, that is. That's right. And how have I been? Justin, been doing well. Thank you. I'm going to go ahead and wrap up this Ask Dr. Vaughn. It was actually a dual Ask Dr. Vaughn. We had Dr. Gawayne Vaughn, if you can see him over there. We had the back of his head participating. And since he doesn't have the mic on, I was able to let you guys know what he actually was saying for real. I'm not making up what he... There he goes. There he goes. Look at him. He's getting to his coat because he's done. He's putting his pen away. Is he leaving? He might just leave. We're not sure. Tomorrow, the radio... Oh, thank you, Empire City Ray, for asking. Yes, 10 o'clock Pacific time, which is 11 o'clock Mountain, 12 o'clock Central, 1 o'clock Eastern. MedicallySpeakingRadio.com is where you can pick up the show, and we're also going to try to Periscope the entire show, so all of you guys can just be on Periscope and ask questions here. And somebody asked about, what does gross mean? Gross means big or general. Microscopic would mean through a microscope. So that's why gross hematuria is, you can actually see your urine is discolored. Gross hematuria is you can't see it unless you test for it. Yes, Empire City, thank you for reminding me about the show, and thank you, Hazaniah. And thank you, Angela, for hanging out with us. And we'll do it again another time. Until then, stay in good health.